My name is Dr. Craig Bosick, and I'm a dentist in Lincoln, Nebraska. My office is VFD Innovative Dental, and I like to think hopefully our name kind of says it all. But when I think about the smile makeover process in my office, I actually think more back to the conversations that happen with the patient. I think that that smile makeover starts with finding out where that patient's been, where they are, where they're going. And so I think a lot of times when we talk about smile makeovers in dentistry, we're talking about huge, gigantic makeover cases where the doctor was doing strictly cosmetic work. When I think about a smile makeover, that can mean a lot of different things. That can mean a level of optimal dental health. That can certainly mean an amazing smile that brings a lot of confidence. But a lot of times for me, the smile makeover is an outgrowth of where what a patient truly needs to feel to be healthy and to feel comfortable and to look great coincides with what they want from an aesthetic standpoint. So I think that makes it a little bit different because I'm not out there telling every patient that we need to redo their entire smile. I'm trying to find out what the patient wants and work forward from there. When I'm meeting with a new patient, spending some time with them, and it comes up that they say repeatedly, I hate my smile, I hate my smile, that usually is my cue to start asking some deeper questions. I want to know, what exactly are we talking about? Do they hate the way it looks? Do they hate the way it feels? Do they hate the way they function? And the confluence of those things drives our treatment plan and our treatment decisions going forward. I think that patients, when they come and say, I hate my smile, it's an opportunity to dive in just a little bit deeper. For me, my most satisfying cases are when a lot of times the patient says that they hate their smile, they don't like it, is because they've been to the dentist for their entire life and they feel like they're never done. It's always the next thing that needs to happen. They come walking in the office, they've got a tooth that has 7 fillings in it, and I say, hey, have you ever felt like you're done at the dentist, like you're fixed and you can just come in and get your cleaning and exam and feel great about it? And the doctor says, hey, we don't need to do anything. Let's just see you the next time. And a lot of times their eyes go wide open. That's never happened to me. That is the candidate for a smile makeover in my mind because I have a chance to make that possible for them. And that means everything because then we can have a conversation where they say, hey, I haven't had to do anything in 5 years. And I love the way my smile looks, which is a complete 180 from where they began. So to me, that's what it's all about when a patient says, I don't like my current smile. So a lot of times when patients are a little bit concerned that they don't have perfect oral health as they get started on a smile makeover type of case, it's a chance for me to step back and say, I agree. Let's talk about the foundation. Let's talk about where we are. Let's talk about that oral and systemic link between perfect oral health and systemic health. Because a lot of times I think the patients, when they say, hey, I'm a little concerned about, do I need everything perfect before I get started? The answer is yes and no. I would say yes, in the sense that I want a solid foundation when we begin any case for any of our patients. So truly, that's the bedrock upon which any case is built, whether it's super complex or super straightforward. But the answer is no, in the sense that I can't do anything. I'm paralyzed because I'm not ready or I'm not there yet. Every single step along the way, for some patients, it's just getting back to the dental office for the first time in a long time. That is a step towards that smile makeover, and that's a step towards that readiness for being able to be a regular dental patient, which is our dream. Some of the things that cause us to take a step back before we start a truly comprehensive case is just because an outgrowth of those conversations that happen with the patient. Sometimes we'll find out that, hey, we do need to address something in the systemic health before we can start. A lot of times in dentistry, it has to do with the patient's overall periodontal health. And when we talk about that, we're talking about the foundational structures, the gum tissues, the bone structure that support the teeth. Certainly, that is the first and foremost in our thought process. We always use the analogy of the foundation. Any project that's going to happen is reliant upon a solid foundation. That's true in construction, that's true in business, that's true in dentistry. So making sure that we have a solid foundation, it opens the door to good conversations with our patients and make sure that we're starting off on the right foot. We aren't in such a big hurry to get to this amazing smile that looks great until we know that it can function great and have the longevity behind it to withstand the test of time. So it can be fantastic 20 years from now, not just tomorrow. When I'm looking at a comprehensive case, the notion of being agnostic, I think maybe is the wrong word. I think the right word that I think of is indifference. And I think indifference gets a bad rap. When I say indifferent, I'm thinking about, I do a lot of reading on Stoicism and Ignatian spirituality. And to me, indifference when it comes to dental treatment is not being attached to what I love to do, to the one thing that I'm good at, the thing that is the most profitable, or any of these things. Indifference means that I can keep an open mind. So, open mindedness is where it's at for me when it comes to my relationships with my patients. So, what that means is by advancing my skill set and having a team of doctors and hygienists and assistants who are all at the top of their game around me, I can constantly be mindful of what is the best for any given patient at any given time. And to me, that takes this indifference and turns it completely on its head. Doesn't mean I don't care. It doesn't mean I'm apathetic. It means that I got to know what's best for that particular person that's in front of me at that moment and deliver on it. One of my favorite types of patients is the patient that comes in as a new patient and tells me, I've been through everything. I've been through so many dental offices. I've been through so much treatment, and I've never felt like I had a plan. That is my cue to step in and say, wow, I think we can be really different for you. If you go with me on this, we can talk about what that means to you. So when I have a patient that's bounced around and bounced around and bounced around, it goes back to that notion that this patient is no stranger to dental treatment. They are thinking that, my goodness, every single time I go to the dentist, I need this and this and this and this. And that is a type of patient that it's a tremendous opportunity. So when I look at that, I think to myself, hey, we've got a chance to truly make a difference for this patient. Let's find out who they are, where they're coming from, and let's go with this. Let's dive in on what idealism or perfection or what a confident, perfect smile means to this patient and then make it happen. Sometimes occasionally we'll have a patient that comes in and feels they're not a great candidate for a smile makeover or a comprehensive case. And I would simply say to that again that the patient's treatment plan might be dictated by exactly where they're at. One of our superpowers as a practice is being able to meet our patients where they are. Usually, if a patient says, I'm not ready for this or I'm not a candidate for that, that can mean a lot of different things. But if we can talk with that patient on a personal level, a new patient coming to us is like gold. I don't run around on roller skates and see a zillion patients. So that enables me to take a step back and dive a little bit deeper into that conversation. And if they say to me, I don't think I'm a candidate for what I truly want, I would say, tell me more. That's why we have 2 ears and 1 mouth. If a patient's been thinking, I've been wanting to do something about my smile for years, I think it's just as simple as picking up a phone, sending a text message. It's easy. We want that first experience in my office to be one where that patient feels so comfortable. They feel like they talked to an actual human being on the other end of the phone who wanted to find out who they are and what they're about. And I think our ability to put that patient at ease, especially when they're coming from a place where maybe they're a little bit nervous about making that initial reach out phone call or email or what have you, I think that is the chance for us to set the stage. I want our prospective patient to feel that from the very first phone call that, hey, I found a place that's different. And then when they show up, I want the perception to match, the reality to match that perception. So they just say, hey, this place is different. And I think putting that patient at ease, a tiny example, in my office, if a new patient comes in, we start with a conversation. We'll sit down across the table from one another, not unlike this. That's a whole lot different than getting stood on your head in a dental chair. And by doing that, we get answers to questions that we may not get otherwise. But just by putting the patient at ease, I think it gives us a real chance to get a little bit deeper on where we're headed.